Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post, DCIS versus invasive breast cancer. What's the difference? First, DCIS stands for ductal carcinoma in situ. Some people pronounce it in situ. Some people call it breast cancer stage 0. Invasive breast cancer is what you think about. Breast cancer that has escaped outside the milk ducts. DCIS are cancer cells that remain in the milk ducts. How this applies to the newly diagnosed either DCIS patient or invasive breast cancer patient is essentially determining stage, which relates to potential therapies. Now, DCIS, the bottom line basically is understanding risks and benefits, the risks of treatment. I can make an argument for not undergoing much of any treatment for DCIS. This is a somewhat controversial topic. Some people consider it to be not cancer. As I mentioned earlier, cancer stage 0. Some people will disagree with that. And what any cancer stage comes down to is treatments, risks, and benefits, pros and cons. So my mom had DCIS. Essentially, she elected at the age of 75 to have what's referred to as a lumpectomy. Essentially, her surgeon removed that very small spot. She did also elect to have local radiation. What those treatment decisions relate to is the risk of not doing anything versus the risk of doing something. Virtually every therapy has risks and benefits. The point of this vlog post is to differentiate between DCIS and invasive breast cancer. Something like a third of all newly diagnosed breast cancer diagnoses are DCIS. Again, I can make an argument for not treating much, if at all, for DCIS. The 15-year survival rates are almost 100%. If you do nothing, they are better if you treat a little. The question then, if you treat a lot, what risks and benefits does that mean for you, the patient? Certainly, if you click through to the blog post, I will discuss this topic in greater detail. My goal of a vlog post is to touch on sort of a synopsis version, in this case, DCIS versus invasive breast cancer. What's the difference? Certainly, if you have any questions or comments, scroll down, let me know. Scroll down, click through to the blog post if you want. You can ask questions there as well. Certainly, click the subscribe button for more information about both conventional and evidence-based non-conventional therapies. Thank you for your time and attention, and hang in there.